Welcome all. Today, we are inviting Dr. Evelina Majumdar to talk about prioritizing health and promoting well-being of doctors. Welcome, Dr. Evelina. We would request you to talk about this very sensitive and important topic.
Thank you, Dr. Sachin, for this opportunity. Your commitment to the field of mental health is truly remarkable. And to my audience, welcome to this presentation dedicated to exploring mental health in medical profession. It's my privilege to be able to present on this subject for an esteemed audience of doctors. I know how much stress and difficulty each of you faces at work every day. So I appreciate your participation and willingness to put your well-being first. Being a medical student is one of the most demanding and difficult journeys that you can undertake mentally, emotionally, and physically. You work for endless long shifts. You have minimal experience, but are responsible for patient care. You deal with the demands of patient families. You are under constant pressure from seniors to perform. You have little time to relax and deal with your own dreams and expectations. And if by chance you choose to leave the course, you have to pay a heavy penalty of up to, I think, 50 lakh rupees. So, this experience is extremely challenging. It's emotionally charged and is so profound and impactful that it leaves a lasting impression, either positive or negative. It can feel overwhelming and therefore difficult to deal with. But I want to say clearly sometimes it's okay to feel overwhelmed. It's okay to not be okay. And today we are going to talk not about clinical cases, we are here to talk about you, your mental health, your emotional well being, and how to take care of yourself while you take care of others. Because the truth is, you cannot pour from an empty cup. And during your training years and beyond, you deserve support, compassion, and tools to thrive, not just survive. Next slide, please. So, these are the World Health Organization definitions of health and of mental health. We have all learned these definitions, but how often do we apply them to our day to day clinical thinking? We focus heavily on physical illness and lab reports. But do we pause to ask, is my patient coping? Are they functioning well? Am I functioning well as a doctor? Because mental health is not just the absence of mental illness. A few months back, one of the most brilliant residents I knew was dealing with a personal problem that had a significant impact on him. But he kept all of it to himself, did not talk to anyone about it, did not bother to deal with the significant life changes that he was experiencing. And gradually he started getting irritable, making small mistakes in his work, shouting at the nurses and other paramedical staff. And yet no one flagged it until he made a serious prescription error. And that error was not because of any incompetence, because he was really a very good student, but it was because he was mentally exhausted, dealing with personal loss. And yet he kept pushing himself because he thought that is what he was expected to do. So, mental health is about whether we are functioning well enough to be safe, effective, and present in both our professional and personal life. So, if we do not talk about our mental health and if we don't normalize taking care of it, we are setting ourselves up for failure. Next slide, please.
Hi, Dr. Evelina. So,
Yes.
could you please explain us what are the workplace challenges and occupational hazards which endanger doctors' health based on your extensive and diverse experience over more than 30 years?
Okay, so I feel these are the commonest challenges encountered by most doctors during the course of their work. In fact, I would ask my audience to think about whether they encounter any of these occupational hazards and challenges. Do you feel you are handling a heavy patient load? Do you believe that your work schedules are unfavorable, maybe due to rotating shifts or unpredictable duties or absence of work life balance? Do you feel the work culture in your institute is toxic? Do you believe that silent ragging happens? I know ragging is banned, but I ask because unfortunately, even after the Supreme Court ruling, silent ragging persists in many institutions. Seniors may not indulge in outright abuse, but they may express their power through taunts or forced obedience disguised as tradition. And there's that outdated perception that ragging makes us tough, but it's flawed because ragging only serves to normalize fear, trauma, and hierarchy. And this can have deeply damaging consequences for individuals and the medical profession. Some individuals come out of ragging resilient, but they are resilient despite it, not because of it. Whereas many other individuals suffer long lasting psychological harm in the form of anxiety, depression, or post traumatic stress disorder. And I believe every one of us would agree that the real strength of a senior is in mentorship, not in mocking or dominating their juniors. Coming to the next hazard, do you feel that although we learn how to diagnose death, we don't really learn how to tell the patient's loved ones that they have passed away in a compassionate manner that is appropriate to their emotional state or maybe their cultural background, their level of understanding and readiness to receive information? Is conveying bad news about your patient emotionally draining for you? And next, do you feel stressed or anxious when making life changing decisions regarding your patients? Like, for example, deciding on the best treatment options or making accurate diagnostic decisions or maybe withdrawing or limiting treatment at the end of life. So, think about these points, and if you do it, it means that you are facing significant challenges during your work. And the last 3 points we will discuss one by one separately. So, next slide, please.
Yeah. Thank you, Dr. Evelina. I think one wonderful point which I picked up uh, right now was abuse, which is disguised in the form of traditions. I think that was
Right.
a very good point, actually, which you have made. I think that's a lot to think about. We'll go to the next slide.
Right.
So can I request you, how do we address these occupational health hazards?
Yes, so as per OSHA's Occupational Safety and Health Administration, hospitals are highly hazardous workplaces with occupational injuries and illnesses occurring twice as frequently as in any other industry. So, addressing these risks, that's a whole big subject by itself, but we will just quickly briefly go through what is required. Is number one is you understand the problem is, and that can be done through a HERA, that's a hazard identification and risk analysis, and a SWOT analysis, which means you need to identify your strengths and weaknesses in the workplace, and then follow it up by implementing effective safety management systems. Then adhere to international patient safety goals and implement violence prevention strategies. So, all of this makes our workplace, our hospital, a more safe one, and a safe workplace is always more healthy. It can significantly impact our health and well being. So, next, please.
Thank you, Dr. Evelina. Thanks a lot. So could you
Yes.
please tell us that doctors who are on the highest hierarchy in healthcare, can they also suffer or can they get also sick physically as well as mind-wise?
Certainly they can, they do. Because our attitude as doctors towards our own health is very crucial. We are the guardians of patients' health. So sometimes we mistakenly believe that illness will not happen to us. It will happen to them, to the patients. We may even feel that our medical knowledge will somehow magically keep us safe. But how can that be? Doctors are only human. We also bleed, we break, we burn out. Our mental health struggles are real, but we are often denied the support to heal. So we do not learn to talk about it or care for ourselves. Suicidal thoughts, ideas, plans, and attempts are not a desire for death. They are actually a desperate cry for assistance, an escape from overwhelming pain. This, coupled with heavy workloads, organizational stressors, and a culture of self sacrifice, contributes to increased mental health issues. Indian doctors are well known for their intelligence. They are losing their lives to mental illness at an alarming rate. So, we must establish a system where seeking help is not seen as a weakness or failure, and we must act before we lose more of our healers.
Thank you, doctor. I think that's a very wonderful point made, that we are human, and I think we are also equally vulnerable. So I think it's very important that we also accept that we'll also fall ill at certain point of time.
Absolutely, yes.
So my question is, we study medicine, we study physiology, anatomy, uh, also pharmacology, and maybe later medicine and various branches of medicine. So intelligence wise, doctors know that there is something called physical health and something called as a mind health, which is different from the general population understanding. So doctors have a certain knowledge, understanding of what is happening to their bodies. So why
Yes.
is mental well-being undervalued?
Yes, that is a very important question. And because mental well being and mental illness is undervalued, that is the reason we do not ask for help, even when we desperately need it. And the topmost reason I would say is because the symptoms of mental illness are invisible and therefore not measurable. You cannot record, say, for example, a graph of anxiety, nor can you measure the level of emotional exhaustion. So it's easier to ignore what we cannot quantify. And there is still an outdated stigma or belief that struggling mentally is a sign of weakness, and especially in medicine, where we are expected to be resilient superheroes 24/7. Our work culture also celebrates working all night through, exhaustion, skipping meals, and so on. But this is not sustainable. And honestly, we are not trained to talk about it. So we avoid conversations even amongst ourselves. So that's the lack of training comes in there. And then Indian care systems are fragmented. With limited infrastructure, there's a serious shortage of trained professionals. So mental health support is hard to reach for most who need it. But I would say for students in a medical college and hospital, there are support systems in place like the psychiatry OPD or a clinical psychologist on board, maybe even a psychotherapist. So, whenever you or your colleagues need professional help, please do not hesitate to go for it.
That's wonderful. I think that's a very important point. I think that there's a need to ask for help, and also symptoms are invisible, so it might pass on as a personality issue, or maybe some other issue which the doctor is facing, but it could be a mental disorder for which an early identification and triaging is very, very important.
Very true.
So, Dr. Ivina, could you just talk about what are the burning issues which are facing our country today?
Yes, actually, we mostly focus on the physical illnesses, and there is more awareness about physical illness, which people are okay to talk about. But physical and mental health are closely interconnected. And for a long time, India has been the diabetes capital of the world. And last year on World Health Day, it was also proclaimed to be the hypertension capital. And the prevalence of obesity has reached epidemic proportions. All of these are predisposing factors for cardiovascular disease, which is the leading cause of death worldwide. And these ailments, they do not pass us by just because we are doctors. Actually, we are at the same risk as everyone else. Although we are aware that making healthy lifestyle choices can help us to prevent or to better manage our NCDs or non communicable diseases, how many of us as doctors or students are able to focus on adapting a healthy lifestyle? How many of us exercise regularly, eat a balanced diet, get adequate sleep, and use positive coping mechanisms for stress management? You really need to introspect on this. And if you do not, then please aim for a healthy mind in a healthy body, because mental health needs a solid foundation. Next,
Excellent,
please.
doctor. Excellent. Very nice. So what are you trying to tell doctors?
Uh, so basically, we keep telling our patients to take care of themselves, to follow up, to rest, to talk to someone. But how often do we take our own advice? There is this poet Gulzar. He has a quote which is very well known, and I think it is quite relevant to us. He says, "तुझे बेहतर बनाने की कोशिश में तुझे वक्त ही नहीं दे पा रहे हम." He is addressing life, and he says, "तुझे बेहतर बनाने की कोशिश में तुझे वक्त ही नहीं दे पा रहे हम, माफ करना ए जिंदगी तुझे जी नहीं पा रहे हैं." And that's what many doctors are doing. They become so preoccupied with their work, with their finances, their personal fulfillment, and raising a family that they forget about their own health and well being. So there is this Latin phrase, medice curate ipsum. It means physician, heal thyself. So this serves as a reminder for doctors to take care of their own health and well being. That's the message that I'm trying to convey.
Thank you, doctor. So could you just explain what do you mean by this slide?
Yes, this is the mental health continuum. Like physical health, mental health it exists on a continuum. It is not a static thing. It is a dynamic changing state. So mental health can deteriorate or it can improve given the right set of circumstances. So mental health concerns, if identified and treated early, have the potential to be temporary and reversible. So this is very significant uh, as far as the management of mental illness is concerned. And as we can see in this model, it goes from healthy, adaptive, or coping, which is shaded in green, through mild and reversible distress. So this is the healthy mental health, a person with good mental health, and then a person with mild or reversible distress. That is the reacting phase. And then on the left, you will see the different parameters against which they are judged. And then towards more severe or persistent injury or impairment, which is in orange. And finally, to clinical illnesses and disorders, which may require concentrated medical care. So these are clinically diagnosable conditions. When the state reaches that level, that means it requires really concentrated medical care and might be more difficult to reverse. So earlier the diagnosis and treatment, better the chances of reverting back to normal.
Thank you, doctor. I think that's quite interesting because sometimes we might not we might react and we might then just take help instead of just going following to the right end of the curve where you're extremely ill. So that's a very good point actually made. That is gradually from mild to moderate to severe distress. And if we can
Mm.
identify and quickly take steps, I think that will help all of us.
That's right.
So what is the slide about the wounded healer? Why? This is a very interesting slide with newspaper cuttings. And what do
Yes,
you what do you want to convey from all this information which you are presenting?
they're actually newspaper articles published after a few of the unfortunate tragic events that occurred within our community in the recent past. And I feel as if after reading so many articles, it feels as if we are heading towards an invisible epidemic of psychological breakdown of our best minds. Suicide among doctors is a heartbreaking topic. In India, a significant number of doctors and medical students are dying by suicide, and this highlights a healthcare system crisis.
Absolutely.
Yeah.
So I think I could say that why doctors are taking the extreme step. Doctor blames a 40-hour duty after daughter dies by suicide. Many medical
Yes,
students have dropped out, and which has been a reality because I think the system produces a lot of unnecessary stress, and also the fear of violence among doctors, which might be stressing them out, because healthcare is a complex scenario. You don't know what happens when you're treating the person, despite the best ability you might have or the best services you might offer. So,
right. So
so
these are all the occupational hazards which we discussed in the earlier slide.
absolutely, and also I think this figure is very significant, where 30% of doctors and physicians go through depression, and also the fact that physician suicide is a public health crisis. And maybe I just wanted to add that I think doctors die much earlier than the general population.
Very true. As compared to other populations, other professions, doctors live a shorter life. Yes, that's a fact. And we'll come to more statistics now.
Yes.
So take a glance at,
So why do you want to say that mental well-being remains a medical blind spot?
because we are ignoring it. Because despite all these statistics that are available, just take a glance at these suicide statistics among doctors or mental health statistics. Sadly, yeah, as you can see here, 82.7% of the doctors, and this was a survey done by the IMA, 82% doctors are stressed out. 28% of undergraduate students and 15% of postgraduate students, they suffer from anxiety and depression. 50 to 60% of practicing physicians experience burnout, and 16% of undergrads and 31% of postgraduate students, they have reported suicidal ideation. And out of the total suicides, death by suicide, 63%, they mentioned depression as a reason for taking the extreme step. So even in face of undeniable facts and figures, in our profession, our mental health is getting sidelined because we are just ignoring it because of the stigma, because of the lack of training, because of all the reasons which we saw earlier. So, colleagues who experience anxiety, burnout, or depression, they are more likely to harm themselves or die by suicide because these conditions are frequently ignored. And therefore, it is critical to identify mental health issues early, get timely professional assistance. There's more statistics coming in the next slide, please.
Yeah, no, absolutely. I think it's a huge tragedy that we have the statistics, we have everything at hand, but due to the hyper competitiveness or the stress which our profession offers, we are
Mhm.
not able to actually help ourselves.
Very-
It's actually quite a tragedy in a sense.
It is. It is. So this data was from the Indian Journal of Psychiatry, and here we see that the maximum number of death by suicide occurs in practicing physicians, followed by postgraduate students and then medical students. And among them also, depression is the top cause of suicide, followed by other causes like marital discord or harassment or bullying and impulsive decisions, and maybe drinking and so on. So these are also alarming statistics, I feel.
Right.
And this is again because of the stigmas and the taboos that we don't discuss it. There's a lot of misinformation. There isn't enough support for doctors, which is really, really sad.
Absolutely.
Next, yeah, next, please. So if you have a look at the department-wise and the region-wise statistics, so somehow anesthesia tops the list, followed by dermatology, radiology, and then there are the other departments: ENT, pediatrics, gynecology, radiotherapy, neurology. And there are more doctors dying by suicide in South India as compared to the northern regions.
Right.
And coming to the modes of suicide, so all the categories of doctors, whether they are practicing physicians or postgraduate or undergraduate medical students, they somehow preferred hanging as the top mode of suicide, followed by poisoning, jumping from heights, all rather violent modes of suicide, I would say. On the right is the advisory from the World Health Organization saying that if you know someone who might be considering suicide amongst your friend circle or in your batch, then reach out to them. Offer to listen, just be there for them. Let them talk, let them open up in front of you, let them talk about their problems without judging them, and encourage them to seek professional help. So you can even help them to get an appointment with the concerned doctors who can be concerned professionals who can help them out. And if you feel that it's an immediate problem, it's that they might be, I mean, that suicide might be imminent, then don't leave them alone because they could harm themselves if they are alone. So call their loved ones or the parents, their family members, or their friends, whoever you know, they in amongst their family or in their close circle, near and dear ones, and also reach out to emergency services so that some help can be given by the time the family members reach, and remove all access to any means of self harm like maybe sharp objects or pesticides or firearms, any medications which are easily available to doctors and they already know which what is the fatal dose of which medicine. So remove all that from the vicinity, and once they have undergone treatment, they have been attended to, check in on them regularly, because it's not necessary that once they have been treated or attended by some professional, they will remain okay all the time. Because, like we saw in the mental health continuum, they might deteriorate, they might improve, depending on the circumstances. So keep checking in regularly.
No, I think these are very important statistics. And looking at hanging and poisoning, which is encompassing the medical students, residents, and physicians, I think it's high time we look at our structures and systems which create a lot of pressure. So I think these are very important statistics. I think which all of us should note.
And this is the age-wise and the sex-wise prevalence. So most death by suicides occur in the age group of 20 to 30 years. I think one of the most productive years of our life, most energetic years, but sadly that's when most deaths are happening. And more of females resorting to death by suicide than males. So these numbers aren't just data, they are a wake up call. And this is happening in our profession, which is built on saving lives. So it's time we start prioritizing the mental health of people behind the stethoscopes. Next,
Absolutely.
please.
Absolutely.
Yeah.
I think this is a younger population which is actually taking their lives. And I think there's a very important need to actually start addressing this age group.
And what happens? What are the repercussions of not addressing mental health issues in doctors? They extend beyond the individual. It will impact patient care, it will impact team dynamics and the entire healthcare system. So, once again, it's very important to diagnose early, to identify the signs and symptoms early, and to provide, to ensure that the individual gets timely treatment.
Absolutely. I think this is very, very important. Even I have not realized this. I think when I was studying as a medical student, and there's so much awareness which is now coming in, which how it actually affects all the areas of our life.
Yes.
So how do you break the stigma, especially in a community like medicine, where doctors actually are well read? They come from certain communities. They have access to finances or cultural capital. So how do you look at breaking the stigma? Because it might be even more stigmatizing to actually share that one might be having a certain kind of emotional distress.
Right. But as medical professions, I feel breaking the stigma starts with us. And in fact, we should be leading by example in treating mental illness with the same urgency and compassion as any physical illness. So, just like we rush to treat a heart attack, we must respond swiftly and empathetically to a panic attack. So, we need to normalize open conversations about mental health in our community. And I remember one senior doctor of our hospital shared that last year he was struggling with sleep issues and with anxiety due to work pressures. And he was in a very senior position, one of the leadership positions, in fact, and his mental health, but he uh, informed that his mental health significantly improved after he had taken professional advice and treatment. So he said that seeking help did not make him a weaker doctor, it made him a stronger human being.
Very
And
nice.
this doctor told his team that if any one of his team members wanted to talk about similar issues that they might be facing, his door was always open for them. So what I feel is that this type of relaxed and honest admission from leaders makes it, seem more normal that mental health problems are common. It can happen to anyone at any time, and it's okay to talk about them. Just like you might, for example, talk about a fever that you're having, or maybe some injury that you had sustained. Similarly, if you have been facing mental issues, it's normal to discuss that also in your group, amongst friends, colleagues, to your seniors, whoever you feel comfortable with. And by doing this, we can give ourselves and our co workers the confidence to ask for help without fear or shame. So that then we can prioritize our mental health and build a community which supports each other.
Very nice. I think that's a very good idea and a very good suggestion. I think we should definitely start doing this so that our community actually seeks help and is able to get over whatever crisis they are facing and normalizing these conversations.
Yes, it's much needed.
So, what could be the strategies for management of our mental health?
Yes, enough of awareness now and time to move on to action. So let us explore some practical strategies that we can use to protect and strengthen our mental health. So first and foremost, we need to be able to recognize the signs and symptoms of stress and burnout because they can impact both physical and mental health. So it is important to learn the steps of self-care and of building resilience also after we've recognized the signs and symptoms so that we can manage stress and burnout and have a more fulfilling life. In addition to what we can do on our own, we can also, our institutions also can create a more supportive and a productive work environment by prioritizing employee health, wellness, safety, and this will benefit both the employees and the organization. Seeking help outside and then the, take getting access to mental health resources. So all of these are very important because they promote overall health and well-being. Let's see them one by one in the next slides.
Wonderful. I think for me, I think institutional changes are very important because I remember that one of the staff had said that they have issues where they have lost interest, they are crying, but maybe they cannot seek help because if they seek help within an institution, they might face a job loss. So these are
Mhm.
very important points which you have mentioned.
Yes, that's a common fear amongst employees that they either their ratings might go low or they might even lose their job. Yes.
So, how do you recognize stress and burnout?
Yeah, so actually, what happens is, as doctors, we often label symptoms without a clear physical cause as functional. But that doesn't make them less real, actually. Recognizing them early is the first step. Otherwise, what we ignore today, it can quietly erode our health, our judgment, and our compassion. So look out for physical symptoms like fatigue, headache, muscle pain, sleep disturbance, digestive issues, which are not, once you've ruled out all physical causes, then it could be a sign of stress or burnout. Then emotional symptoms like feeling helpless, irritability, mood swings, lack of interest, self-doubt. Behavioral symptoms like absenteeism, procrastination, substance use, compulsiveness, frequent errors during the course of work. And then cognitive symptoms like forgetfulness or decreased problem solving skills, negative self talk, lack of purpose, feeling stuck, and so on. So once we are have ruled out all the list of differential diagnoses which we generally have, and then we find that no, it doesn't, these symptoms don't fit into any of those illnesses after having done whatever tests or whatever investigations we generally do. So we should not be ignoring them as just simply functional and laugh it off, because they could certainly be symptoms, signs and symptoms of stress or burnout.
Absolutely, absolutely. So, what to do about this?
Yeah, look after your body and soul, because we are healers and we also need healing. So acknowledge, accept your feelings that yes, this is how I'm feeling, this is what I'm going through. When you say it to yourself, then you will have the confidence to discuss with someone else also. And then you seek support. You give priority to your own care, your stress management. Learn to say no, set boundaries, practice relaxation techniques, maybe meditation or listening to music or yoga or whatever it is that works for you, and re-evaluate your priorities and goals. What is the most important? Attend to that first. There might not be time enough to do a whole list of things. So do what is most important for you, what helps you go closer to your goals, your to achieve your dreams.
Right. So, is self care a necessity or a luxury? Because we always have been taught that I think we need to just keep working, and there is a set amount of guilt which comes in when we want to take rest. Because
Yes, we are brought up like that. But actually, self care is an antidote to burnout. It is certainly a necessity and definitely not a luxury. So we must pay attention to our physical health with regular exercise, eating healthy, getting good quality, adequate sleep by practicing good self sleep hygiene, take care of our emotional health through mindfulness practices, and cultivating positive social connections by giving some time or taking some time out from our busy routines for our hobbies, because hobbies are what will, they keep your mind relaxed, they keep you happy, so they help to de-stress. And professionally, set boundaries. Make sure that if you are being asked to do some work after you've just finished your call duty, for example, you just say, no, sorry, it's my time for rest. It's my time to recoup or whatever it is I want to do. I cannot do this work anymore. I have done my job for the day is done. So set boundaries, prioritize your tasks, like said earlier, make a list of things which are more important and go downwards. And whatever is more important for you to achieve your goals, to reach your dreams, do that first. Take breaks throughout the course of your daily routine. And then, as a long term, also take vacations. Maybe every few months, go for a longer vacation for a few days, maybe with your friends and family. So that will certainly help you to rest and recharge.
very nice points, very important. So, how do you build resilience uh, in our community?
Yeah, so resilience is actually the ability to tolerate stress. We don't understand what exactly it is. There's this book written by Dr. Patricia, and she enumerates many tools for doctors to build their resilience. She says she has given a lot of good advice on how to save lives without losing yours. So don't put your life at stake just while you are trying to save your patient lives. And resilience is basically the ability to tolerate stress and to bounce back from hardship. It could be psychological or emotional or physical hardships that you are facing, and then adjust to the new situation. So, just like, it's like developing immunity. It's developed gradually through exposure to difficult situations, gradual exposure to the pathogen, and then your body builds up immunity through your cells, how they react to the bacteria or the virus that they have been exposed to. Or like vaccine and the principles of vaccination. Similarly, when you are gradually exposed to some of the other kind of hardship, maybe it's psychological, emotional, or physical, and then you get to relax, then you recuperate. So then your mind starts getting adjusted to that situation. Oh, this is the type of situation a doctor can face. It could be that there are hostile family members for the from of the patient, or it could be that I'm facing uh, very tough schedules and so many whatever different hazards that we already saw. So gradually, when you go on repeatedly being exposed to these kind of hardships, then you develop that resilience to tolerate the stress, to bounce back to normal.
Nice, nice. Thank you. Thank you, Dr. Elena. So there is a lot of intellectual work done in terms of having a national task force on mental health and well-being of students.
Yes.
There are institutional steps. So how does one operationalize it? Because a lot of discussion goes around it. We are losing doctors. We are losing our own health. There is a crisis in the community. So how do you think all these things could be operationalized in our system?
Yes, this National Task Force on Mental Health and Well-being of Medical Students, which was published in 2024, it provides a comprehensive list of steps that can be taken by the institute. And I think all the doctors who are in authority in that institution, in an administrative capacity, the dean, the administration team, all of these people, the different heads of departments, they are the ones who should be getting together and going through these suggestions, the entire list of steps, and then personalizing or sort of mm, applying them to their own institute, how to actually practically implement it in their institute. Because without these changes, we risk continued exploitation of young doctors and irreversible damage to our healthcare ecosystem. So on the right, I have suggested some steps from my side, but of course the National Task Force has given a long list, and I feel some important ones which are very frequently discussed are ensuring access to mental health resources like maybe online counseling through Telemanas, which is 24/7. It provides a support system 24/7 for anyone who you just have to ring up the number and call them. Uh, Very important one is limiting the working hours to not more than 70 to 74 hours a week at least. And that's what I feel, and not more than 24 hours at a stretch. I am not sure how and when this will happen, but if it does, it will be a boon to our doctors. Uh, Providing training in stress management and emotional regulation, because we don't have such soft skills, and so we are not able to cope with the challenges that we face day in and day out. Addressing the stigma is very, very important, and it starts with us. We need to start talking about it and discussing within our circles and then with people of the larger community. Promote a healthy work life balance that will definitely reduce stress, and have open communications through a supportive work environment where mental health concerns can be discussed without fear of stigma or judgment, without fear that I might lose my job or I might get a low rating or people will shame me. or without feeling embarrassed, basically. So, to truly care for patients, our institutions must first care for the hearts and minds of those who serve them, and that's our students, our doctors. And our institutions must set up systems which will support our doctors and our students and not strain them.
Absolutely. I think I just went back to, I think, your first statement saying that we have to fill our own cup, and also
Right.
the Gulzar poem which you mentioned, because if the junior doctors keep seeing the senior doctors as just running around all the time
Mhm.
and glorifying the long work culture, then how does one bring change? Because if long working hours are being glorified and said that this will toughen you up and this will make you a better physician, so I think the poem quite aptly applies where you are just trying to keep running and you're not in the present moment and not taking
Yes.
care of yourself. So I think all these points are very, very important, and I hope there would be change in the medical system. As you rightly said, it's a difficult ask, but I think there we need to start somewhere.
Yes, we must.
So how do you
So,
seek help? So you
yeah.
saw we saw doctors who have died by suicide, and these are very
Mhm.
senior physicians, and you
Mhm.
see medical students also. But where do they seek help? How does the doctor seek help?
So many different avenues. You could either go to um, medical health professionals like psychiatrists or psychologists or psychotherapists. You could or you could be a member of the support groups which are online and which are physical groups also in person. So these could be, for different illnesses, like maybe there are support groups for schizophrenia or depression or different kinds of groups, or there could be groups where you can approach during some kind of a mental health crisis that you're experiencing. So you could be a member of that. There are always hotlines and helplines to help you out. You can have access to online resources, mental health websites, and mobile apps. They are galore available, and you just need to have time to go through them and understand them and actually apply them to your life. And you can always reach out to friends and family members, whoever you feel comfortable with, so that you can share your concerns with them and request them for support. Just they can hear you out, they can talk to you, and they can help you out in whichever way you want them to. But you need to reach out first. And then finally, self help. So, whatever you feel like, you feel that whatever helps you to relax, to whatever helps you to feel at peace, you can do that, like meditation, yoga, some physical activities like maybe dancing or walking or going for hikes or treks, whatever works for you. Journaling, some creative work like poetry, drawing, painting, so on and so forth. So that is self help basically. So we have already seen that seeking help through any of these methods, it's not a sign of weakness or of failure. It's a step towards strength, healing. It will help you to stay whole. So be sure to reach out to anything or any mode of help that you are comfortable with. Don't keep bottling it up inside you.
Absolutely. I think this is the most important point which is made to actually seek help, because we feel shy to either seek help, or we feel that we might become a lesser person if we do that. And also, I think maybe take out time for the other activities which you have mentioned, like maybe meditation, physical activity, journaling, because even on Sundays, we go and attend a medical conference. So our
Mm,
entire lives are just packed with medicine, and there are no other avenues which we develop to de-stress ourselves. So I
yes.
think this is a very important point made, and also maybe a special hotline, because if doctors feel shy that they could be speaking to some counselor, there could be like a doctor-specific helpline which they could actually access and speak to.
Yes, that's a good idea. Yes.
So we come to the last slide, and I would request you to summarize about this entire topic of prioritizing health and well-being for doctors, and what is the need of the hour, and what could be the next steps in case we want to start sensitizing the medical college students first, who are relatively new in the system, then maybe the residents, and then maybe the senior doctors and mid-level doctors who are already there in the system.
Yes, so this slide is just a little brain teaser actually. There's a tongue twister here. And it says that when a doctor needs doctoring, does the treating doctor treat them as they would want to be treated or as the patient doctor wants to be treated? So what is your opinion on this? What is your take on this? Just think about it. Because basically the message that is to be conveyed here is, do we practice empathy and do we default to our clinical lens, when treating one of our own colleagues? That is what is here. And it turns out that, yeah, you need a whole village to keep a healer whole. When a doctor is not well, then mm, everyone can help them out actually to come back to normal. So yeah, that is this slide. And the next slide.
Absolutely.
Yeah.
Absolutely. I think that's very, very important because doctors also need to recharge, and society has to actually help them get back when they have drained themselves out.
Yes. So mental health stands stronger when supported by all the pillars of wellness. So here you have financial, social, spiritual, all the kinds of different kinds of wellness. So you can actually approach experts in these subjects, maybe financial experts or spiritual gurus, environmental experts, to be able to connect to all kinds of wellness, to be able to have to achieve all kinds of wellness so that your overall mental health is stronger.
Yes, I think this is a very good slide, and this just reminds me of the pandemic which we faced, I think, 6 years back,
Mhm.
where I think the general population as well as doctors went through tremendous strain, and because they were exposed to the pandemic in the front lines, and also the kind of stress they face. So I think all these points are very important, and maybe if we can imbibe them in our day-to-day living, and maybe make it a habit, I think it will help us a lot when we deal a crisis, or we are faced with adverse situations. And as you mentioned the word resilience, with that ability to see how to come out of a crisis.
That's right. So finally, even the healers must listen to their own heartbeat, because only the self aware can truly heal others. So if you are aware that yes, you are okay physically, mentally, emotionally, in every which way, only then you can take care of your patient. And for your patient, it will be so good to see that yes, my doctor is also healthy, he or she is taking steps to take care of their own health in every way. So when you are whole and the patient can see that you are making efforts to keep yourself good in good health, then it is a win-win situation for everyone. So what I can say is that yes, thank you all the doctors, the students, for everything that you do, because we know that these years are tough, the long hours, the immense responsibility, and the emotional toll. But keep going, because every doctor who came before you has walked this very road. They have struggled, they have fallen, they have emerged stronger on the other side. So don't lose hope, because one day you will look back and you will feel deeply proud of how far you have come, not just as a doctor, but as a human being. So please take care of yourself, take care of each other. That's it from my side. Thank you.
Thank you, Dr. Evelina, for this wonderful presentation. I think the takeaway point, which I understand, is I think seek help. I think that's the most important point I have gathered, and maybe indulge in preventive care, because we always try to cure everything. And I think if we ourselves start taking care of prevention, then maybe I think the patients also will be motivated to actually start following a healthy lifestyle. For the silent killers like heart disease, diabetes, mental disorders, and distress, what we see today. So I think I carry back the message saying that I think one should seek help and take out time for yourself. And thank you very much for this entire presentation made so thoughtfully, putting the problem statement, putting the kind of problems doctors are facing, the statistics, which makes it even more serious for doctors to mull about, and the entire strategies which they can devise to actually address this crisis which they are facing and maybe come out of it as quickly as possible. So thank you very much, and I will stop sharing the slide and I will stop recording the presentation. Thank you.
Thank you. That's the end, na? That is ended.